Hello and welcome. My name is Zafar Iqbal, and you're watching the Mojo Story. Now, the Omicron variant, which has been classified as a variant of concern by the WHO, just like the Delta variant, has triggered worries across the globe due to its high transmissibility. Omicron is three times as infectious as the Delta variant, and war rooms are needed to contain it. That's what the center has told the states. A series of prevention and containment measures have been included, including extensive testing, night curfew, and regulation of gatherings. Uh, now, the number of Omicron cases have been rising in India. As of now, there are 214 cases, Delhi and Mumbai topping the list of the places where most of the cases are being reported. Now, to talk more on this, we're joined by Dr. Dileep Mavalankar from the Indian Institute of Public Health in Gandhinagar. He has been named as in the Stanford list of the top 2% of the most cited scientists in various disciplines. Welcome to the show, Dr. Dileep Mavalankar. To begin with, how serious is the threat? We're seeing that cases are rising, particularly in places like Delhi.
I think it's a time to get alerted because this virus is very much more transmissible
Yeah,
than the Delta variant. And in South Africa and
yeah,
now in UK and in US, it has caused major increase in the cases.
yeah,
Fortunately, it has been in India entered somewhat late and
yeah,
cases are small in number.
yeah.
But this is the time to take the necessary actions to stop the spread of this variant. Otherwise, it might happen that we may face situations like in UK and Europe where we have to think of lockdowns.
Right. But are there any specific symptoms for the Omicron patients?
Omicron symptoms are similar to the other symptoms, except that there is more of certain symptoms like headache and tiredness, plus
Yeah.
nasal congestion.
Uh,
Loss of smell is not so much there. And the fortunate part is that many cases, as of now, seem to be mild.
right.
In Africa, clearly majority of the cases are mild, and some of the hospitalizations are also not because of Omicron, but as incidental findings, who are people admitted for some other diseases.
Right. So more transmissibility, but milder symptoms.
Yes, yes, exactly. That is what the current picture is. But we still have to wait and see because in Africa, like in India, the
Yeah.
population is quite young and
Yeah.
initial cases were in the young population. And that could be one of the reasons why symptoms are mild. But as it goes to older populations and goes to Europe and US, we will have to see. But
Yeah.
even in Europe, as of now, at least 3 weeks information is that not many hospitalizations, but the European countries are really, really worried. And some
Yeah.
of the countries like Holland have already declared lockdown in spite
Right.
of Christmas coming.
Right. But do you think then it's a worrying thing that we are hearing that lockdowns have again been, uh, announced in certain countries? But do you think that it's time to introduce booster doses in India? That's not happened yet.
Yeah. So I think we have to review our own and international evidence and see
Yeah.
what is the best way. Because booster doses have been started in US and UK and many other countries, but in spite of booster doses, the cases have increased in UK. So we have to evaluate that evidence. But I would say that if we want, we can think of at least first doing the immunological work. How many doctors and nurses who were
Yeah.
vaccinated in January,
Yeah.
February,
Yeah.
March have
Yeah.
antibodies? Even those
Yeah.
studies, if we do, we will know. If they have antibodies, then it is okay. But if they have, most of them have lost antibodies, we have to at least think of vaccinating in booster or a third dose in those people first.
Yes, the frontline warriors, the doctors particularly. I
Yeah.
was just going through a report. Telangana has reported its first instance of a local transmission of Omicron variant on Tuesday. The doctors, in particularly, are more vulnerable. So do you think that, but perhaps like what happened in the earlier waves, they should be the ones who should be focused on?
Yeah, so if we are have the evidence for booster, we should first focus on the health workers and frontline workers. So
Uh,
even if we have the third wave, they are not scared and they are prepared to
yeah,
treat the patients which will land up in the hospital. The second thing people have been saying that in
uh,
Western countries, if it spreads very rapidly, even if the proportion of hospitalization is very small, but if the cases are very large, you will still get the hospitals filled up because
right,
large numbers will, even small
yeah.
proportion can make a lot of cases in the hospital.
But why haven't the booster doses been introduced? They're denied so far. Is it because that the eligible population is being targeted by the government first? That is the main concern, and then perhaps they can go to the booster doses.
Yeah, I think government's first concern is to cover everybody who is still unvaccinated.
Yeah,
Second is we have to also look for the evidence that
yeah,
boosters will work and what is the need for the boosters. So that are the two things.
yeah,
But I want to also raise a third issue that
right,
all these vaccines in India and internationally are still under emergency use authorization.
yeah,
So it's not clear to me why the government has not given full market authorization to these vaccines because we have lot of data now. 1 year has passed almost. We have given more than 150 crore vaccine doses roughly.
yeah,
We have the side effect data. So if the full vaccine uh, authorization, market authorization is given, then people can buy the booster doses in the market. Government doesn't have to then worry. Those who need the booster doses, those who
yes,
feel they are wanting it, they can buy in the market. So that could be a third approach to
right,
consider for emergency use. We did last year, and now this is the time to consider and convene the committees to give them full authorization for marketing commercially.
right. And there are no problems as far as the efficacy of the Indian vaccines are concerned. Those apprehensions have been laid to rest. Right.
Data is there. They have to examine the data. See,
Yeah,
initially we gave emergency authorization because trials were not complete. Some trials
yeah,
were continuing, some trials follow up was not
yeah,
there. So now
yeah,
we have 1 year of the follow up data.
right.
And I'm sure the companies would have prepared enough data to consider for full authorization,
Yeah,
because if the safety is there, if the efficacy is there, then there is no point in withholding the full authorization, because full authorization also makes people believe, because currently everybody says this is a new vaccine. Those who are skeptics are worried because there is no full license.
right,
So any drug which is completely safe and should be offered should have market authorization.
right. True. And, the Prime Minister is holding a review meeting tomorrow on this issue. But talking about vaccines and children, do you think it's also time to get children vaccinated?
Yeah, so children's vaccination is another level of issue,
Yeah,
because one thing is that children have much milder disease. So, first
yeah,
of all, whether we really need a vaccine or not is an issue. So, that has to be established, that how many children got affected in these two waves, what was their outcomes, etc., and think of the need for vaccination. And what some countries have done is gradually reduce the age, as we did
uh,
up to 18. We can start from
yes,
16, then 12,
yeah,
etc.
yeah. I think the IMA has also, sought that the government expedites the vaccination of individuals between 12 to 18 years.
Yeah, yeah.
Right. So uh, I think it's perhaps what people have not forgotten those visuals of the second wave. When there was a lot of crisis all across the country, maybe the country was not prepared for that. Do you think we are well prepared, if at all, a third wave hits?
No, we are well prepared in terms of maybe hospitals,
Yeah,
oxygen, and other systems, but our epidemiological preparation maybe needs to be bolstered up.
Yeah,
Also, data transparency, because the data which the government releases,
yeah,
for example, we just have the number of cases and number of deaths. We don't know how many are hospitalized, because see, with Omicron, hospitalization becomes more important. If we are seeing more hospitalization, then we should be worried. Now,
yeah,
cases are so mild that many people will not be even tested.
right,
So we have to have much more detailed analysis. The second is how many of the cases have taken one vaccine, two vaccine,
yeah,
no vaccine. So what is the
yeah,
vaccination? So is there vaccine breakthrough? Because if there is substantial vaccine breakthrough in terms of infection, and how much is vaccine breakthrough for hospitalization, so
yeah,
that data if we can publicize, then we
yeah,
will have better, people will have better understanding of what is the severity of the variant, because there is no doubt that it is spreading much faster.
right,
Second is what is the immunity level, because our last immunity survey is of June, July. We should
yes,
do further immunity survey. Even cities should do their own immunity level surveys. They are not so expensive. Cities should spend the money and see. Because if there are already 70-80% people having antibodies, by boosters, we are just boosting
yeah,
them further. But
yeah,
if there is a lot of antibody loss, then the
yeah,
boosters may become more important. Similarly, we need to do T cell immunity studies, which we have not, or very few studies have been done. Because even if
yeah,
you don't have antibody circulating in the body, you may have T cell immunity, and that will protect against severe disease. So, those studies
right,
also need to be done. So, all that research part may be
yeah,
happening, but it is not in public domain. So we don't
right,
know that. And state governments are also not investing in research. It is seen
right,
that only research authorities are national. There is hardly any state government investment,
right.
institutions, even though they run medical colleges, they run departments of medical education and research, but very little research happens.
So there's need to be to have more research to understand the whole thing in a better way.
Yeah, so because we have such large data available, for example, how many people got doubly infected?
Yes,
How many people got Omicron after the Delta or previous infection? We don't have those numbers because vaccination will depend on the immunity level. So
yes,
to answer all this, because otherwise what will happen is we will recommend vaccines because everybody else is say doing booster doses. So
yeah,
if we understand our immunity, our immunization and immunity levels, then we may have better understanding of the need for boosters.
exactly. And also, you raised the issue of infrastructure, perhaps hospitals, oxygen supplies. They are in adequate numbers available now. But what about the manpower of the doctors, the health workers? Do you think that there is a shortfall on that count, or it's okay in that regard also?
There is always shortfall. If you see in manpower, somehow governments have been reluctant to invest in more people, and there are many positions vacant,
Yeah,
people holding two, three charges, and
yeah,
in temporary manpower can be hired. But it may be much better to have, in some sense, dashboards for various states saying, okay, we have so many beds ready, so many doctors,
yeah,
so many positions vacant, we are
yeah,
hiring so many people,
yeah,
etc., etc., so that people also have confidence. Because one thing which lacked in the second wave was people didn't know where the beds were available, how many beds are full, how many beds are vacant,
yeah,
etc. So we
yeah,
have to have transparent mechanism of people to know where to go in terms of care to be provided.
right. And of course, there are concerns across the world. I was just reading a tweet by Bill Gates. He said that uh, he's actually put out a series of tweets. He says, "Just when it seemed that life would return to normal, we could be entering the worst part of the pandemic. Omicron will hit home for all of us. Close friends of mine uh, now have it, and I have cancelled most of my holiday plans. So the worry, everybody is worried at this juncture because people have not forgotten the second wave when it hit India and the rest of the world. Do you think at this point in time, perhaps lockdowns are the answer? You refer to the lockdown in places like Holland.
My sense is lockdown is extreme. So one thing we must understand is virus is rapidly spreading, but we are helping it to spread. If we
Right.
maintain proper distancing, if we maintain
Yeah.
proper masking, and I would say even N95 mask, because many people can afford it, the virus cannot easily spread.
Yes.
So, unless you gather, unless you are careless, the virus has a natural tendency to spread, but we are helping through our own actions. So,
Yeah.
if we become somewhat circumspect, and Anthony uh, Fauci said that small parties at home is okay, but not, don't go in large gatherings or large gatherings indoor. Even large gatherings, if they are indoor, have to be properly ventilated because the
Yes.
virus circulates more in ill ventilated air
Yeah.
conditioned places. So
Yeah.
those kinds of things we must keep in mind. These are simple things. Second is somehow we are forgetting how to boost our immunity, and there the role of vitamin D has been shown to be very important. And we have a lot of sunlight, or we have to take additional vitamin D that will increase our immunity. So all that will help reduce the virus effect. The other thing is
Right.
we already suffered from a COVID Delta wave. So many
Yeah.
of us may have knowingly or unknowingly been infected and have immunity. And that is why the studies of immunity become more important to decide future course of action.
I think some states have taken a lead in that direction. Section 144 has been imposed in Maharashtra in view of more cases coming up. Uh, all those steps have been taken in the past, and perhaps some states are doing that. But gatherings are taking place. The two states are going to elections, UP and Punjab. So obviously there will be election rallies, public meetings. So that's also a cause of concern.
Yeah, my sense is whatever gatherings can be avoided. And in some sense, we have now experience of the Delta wave of April, May.
Yeah.
Elections may be possible to postpone by a year or so. Nothing, heavens are not going to fall
Right.
by postponing the elections. And had we done it that time, maybe we would have been in a better place.
Yeah.
Uh, but given our democracy and our polity, if
Yeah.
we have to do it, then we have to have a strict protocol. Unfortunately, in India, nothing is strict. When we
Right.
say strict, people take it lightly. So that is one of the issues. Of course, we are in a different time now because we have much more immunity than what we had in April, May. By
Yeah.
vaccinating so many people, 60, 70% have first dose, 30% have second dose, and also the natural infection. So we may not see the same unless there is a major vaccine breakthrough variant which may come. Lastly, this variant seems to be much milder. So,
Yeah.
in some sense, many people have been feeling that this could be the end of
Yeah.
COVID, and this is the way the virus will become endemic. So, it will become very widely spread but very mild
Yeah.
and much less hospitalization, and then it will turn into any normal cough and cold type virus. So
Yeah.
that may be the beginning. So next few weeks to few months, we will know what is the status of our immunity as well as uh, the nature of the virus.
And also, lastly, about travel restriction. Travel can't be banned, but perhaps unnecessary travel can be stopped.
Yeah, yeah, sure. Unnecessary travel, people have to voluntarily stop. if required, and if there is too much crowding happening in certain places, that can be enforced to stop
Yeah,
unnecessary travel. Only thing is, we have to balance the economy versus what
yeah,
actions we take to stop. And that is where the other side of science, which just recently I heard Anders Tegnell, which is the chief epidemiologist of Sweden, who had
yeah,
taken a very different view. His view is we are not doing studies of transmission. Our scientific organization should focus on transmission studies. Where is the virus getting transmitted? Is it in airports? Is it in shopping malls? Is it in crowded restaurants and bars? If we have known this, then we could have more nuanced closure policies or restriction policies. So that unfortunately our scientific organizations haven't done, but we should
yeah,
do that, how the virus is getting
yeah.
transmitted.
Where exactly are the hot spots where
Yes,
the
hotspots, and which are the most
transmissibility rate
likely
is?
circumstances under which transmission happens. So those then things can be avoided.
So perhaps travel ban is not an answer, but unnecessary travel need to be avoided,
Yeah, yeah,
given the scale of transmissibility.
sure.
And lastly, finally, have we learned our lessons? Now it's been quite some time that we are hit with these COVID waves, different variants. Have we learned lessons for any sort of a future, wave hitting us? Have we learned our lesson that could
Yeah, yeah,
perhaps
we
help us
have.
to deal with it effectively?
Sure. We have learned short term lessons in terms of how to set up hospitals fast, how to scale up the oxygen
Yeah,
capacity, etc., etc. But I'm disappointed that we haven't, even in this parliament, 26 bills were introduced, but there was no public health bill or there was no epidemic act introduced to modernize. We are still under the British Epidemic Act of 1897. So we
right.
have to have long term lessons. Even
Yeah,
the health department, the infectious disease hospitals, the whole infectious disease and epidemiology, I don't see major changes. It is the same emergency management situation which
yeah.
we are dealing. We have 1 year's time, we could have developed much better emergency management, epidemic management, epidemic modeling, uh, this thing, even immunology institutes. Of course, there are plans in the pipeline in this Ayushman Bharat and Atmanirbhar Bharat plans are there. But we can focus much more on the public health side and preventing future pandemics.
So it should not be just emergency management, but we should go a
Yeah, yeah,
notch
yeah.
higher. We should perhaps have legislation that everybody should put their act together to deal with this pandemic in a better way. So perhaps it's time for all of us to raise our guard and not to let our guard down to counter any possible third wave that can come to our side.
Sure, sure.
Thanks so much, Dr. Dileep Mavalankar, for
Thank
joining
you.
us. Thanks so much. That's all we have in today's show. Thanks a lot.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.